Chapter 12, behavioral emergencies. Emergency medical responders need to give psychological report as well as emergency care sometimes. Factors that contribute towards behavioral changes could be things like medical conditions, physical trauma, psychiatric illnesses, mind-altering substances, and situational stress. Remember, when we're doing our scene size up, we always do all of our steps: primary survey, history taking, secondary assessment, and reassessment of the patient. We always reassess to make sure that we're doing the correct things. Behavioral crises, emergencies, or situations which persons exhibit abnormal and unacceptable behavior that cannot be tolerated by the patients themselves or by the family, friends, or community. 5 main factors that contribute towards behavioral changes. Obviously, number 1, medical conditions, uncontrolled diabetes, respiratory conditions with difficulty breathing, strokes, okay, head injuries, high fevers can cause people to become unstable. Infections can cause delirium. Excessively low body temperature can also make people do strange things. They also have the loss of the ability to feel things when temperatures are really, really cold. The skin is unresponsive to any pain or pressure or anything like that. They don't know that they're hurting themselves sometimes. Physical trauma conditions, head injuries, or injuries result in shock, inadequate blood supply to the brain. Shock is the inadequate perfusion. Shock is caused by inadequate perfusion. In other words, not enough oxygen being sent to the vital structures of the body. Then there's obviously psychiatric illnesses, depression, panic, psychotic behavior, things like that. Mind-altering substances, could be alcohol, could be chemical substances, drugs, things like that. Okay. Situational stress, such as the death of a loved one or serious injury to loved ones. People go into a very defensive mood or way of doing things, and sometimes they put themselves and other people at risk in doing so. The state of emotional upset or turmoil is caused by a sudden and disruptive event. Most situational crises are sudden and unexpected. It cannot be handled by a person's usual coping mechanisms. Okay, last only a short period of time and cause socially unacceptable, destructive, and dangerous behavior. The mind goes into a self-preservation mode sometimes. There are 4 emotional phases to each situational crisis. People may not experience every phase, but they will experience one or more of these emotional phases. High anxiety and emotional shock, followed by denial and anger, remorse and grief. Okay, high anxiety is characterized by flushed faces, super red face, looks like they're a raging Red Bull. Rapid breathing, trying to get as much oxygen in, feed the oxygen to the brain and the muscles all at the same time. So rapid speech, talking quickly, trying to negotiate things. Increased activity, they almost start to pace. Loud and screaming voices, general agitation. Emotional shock is often a result of a sudden illness, accident, or sudden death of a loved one. Emotional shock can be characterized by cool, clammy skin, a rapid pulse, weak pulse, vomiting, nausea, okay, and general inactivity and weakness. Very close to the signs and symptoms of shock. It's probably very close to psychogenic shock. The refusal, the denial part, obviously the refusal to accept the fact that the event has occurred. Your response should be as follows: allow the patient to express denial. Don't argue with the patient. Try and understand emotional and psychological trauma that the patient is experiencing. Okay, the normal human response to emotional overload or frustration, and may follow denial or may replace denial. It's anger. People get very their feelings, or angry feelings, they want to vent them at you, they want to shout at you, they believe that you could have done something when maybe you couldn't have. Do not take the person's anger personally. Okay. Frustration and a sense of helplessness can often build to anger. When people are cornered or trapped in a corner, they don't know anywhere else but to lash out. Always be professional and remain calm. Okay. Accept the situation may lead to remorse or grief. People may feel guilty and apologetic about their anger afterwards or their behavior. Just remember that's not the person, the normal way of doing things. And it's not a personal thing. They aren't lashing out at you, they're just lashing out at the world. Okay, the role of the emergency medical responder is to form a scene size up always. Perform a primary survey. Is the patient alive, dead? Are there any life-threatening conditions? Do baseline vitals. Then obtain a sample history and medical history, doing a secondary assessment, dots, deformities, open wounds, tenderness and swelling, and provide ongoing reassurance, reassessment, as well as reassuring the patient, continually trying to calm them. Encourage them to breathe deeply and to center themselves. Most important assessment skill is your ability to communicate with the patient. Always be calm, introduce yourself to the patient, ask them their name, ask what you can do to help them, be honest, warm, caring, and empathetic. Position yourself at the patient's eye level, never stand over the patient. Always crouch down, try and get to the same eye level as the patient. Establish eye contact with your patient and just continue. Use your calm, steady voice to provide honest reassurance. Try to not let negative personal feelings interfere with your attempt to provide assistance. Simple acts of kindness can provide some comfort and reassurance. Smiling and a good body posture will help the patient get over his fears and anger, things like that. Rephrasing a person's own words and thoughts and repeating them back to them. Become honest and give the patient hope. Do not give false hope. Always be honest, even if you say things aren't good, but help is on the way. Okay, redirection helps to focus a patient's attention on the immediate situation or crisis. Okay, use redirection to alleviate the patient's expressed concerns. Move the patient to a quiet, more private location. Empathy, imagine yourself in another person's situation and sharing his or her feelings or ideas. Empathy is one of the most helpful concepts that one can use. Use a calm, caring approach. Principle of assessing patients with behavioral problems is most important to identify yourself and let the patient know that you're there to help. Inform the patient of what you're doing. Always talk and explain things. Ask the questions in a calm, reassured voice. Allow the patient to tell you what happened. Don't be judgmental. Show what you are listening, using restatement and redirection. Acknowledge the patient's feelings and assess the patient's mental status. Communicating with patients with developmental disabilities. These things are sometimes very difficult. 1 in 6 children may have a developmental disability. Could be anything from a learning disability to a mental disability to autism, Down syndrome, anything like that. For example, patients with autism might avoid eye contact, want to be alone, not to look at objects when another person points at them, they look the opposite way. Having trouble expressing their needs using typical words or emotions. They appear unaware when people talk to them and they respond to other sounds. Okay. They have trouble adapting when their routine changes. They prefer not to be touched. In fact, they insist on not being touched or held. Rather keep your distance, be close, caring, comforting, and try and get down to their level. Crowd control may help reduce patients' anxiety when there are too many people standing around them. During your scene sides up, determine whether the crowd that might become hostile, it is better to ask for help earlier than to wait. Okay, in domestic violence, which is a common occurrence these days, It could be either child abuse, elder abuse, or spousal abuse. Okay. When responding to a domestic call, maintain safety of the rescuers as well as the patient. Remember, your own safety is always most important. Okay, conduct an effective assessment and treatment. Understand the requirements for reporting abuse in your state. All areas, all regions, everywhere in the world, okay, have different requirements for reporting abuse. Your job is to take care of the patient first and foremost, keep him alive until other help can get there. Okay, physical signs of abuse, obviously broken bones, cuts, head injuries, bruises, burns, scars from old injuries, injuries in various stages of healing, and internal injuries. Remember, battered children and battered wives, sometimes the injuries are not always visible on the outside. There might be excessive bruising in certain places. No? Emotional symptoms such as depression and suicide attempts, alcohol abuse or drugs, feelings of anxiety, distress, and hopelessness. Abusers may become paranoid and overly sensitive, and they might try and stick their nose into your assessment and your treatment of your patient. They'll always try to insert themselves into the process of treating. Okay. If you suspect abuse, your responsibility is to maintain safety for yourself and the patient. If you can't, just try and separate the patient from the abuser. Try keeping from judging the patient. Okay. The presence of law enforcement personnel may be helpful, and learn the requirements for reporting abuse in your state. Obviously, the cycles of abuse, abuser will become very angry and often blames the victim for being maybe clumsy, or it's their fault, or whatever the case might be. Explosive phase is when the abuser becomes enraged, loses control, as well as ability to think clearly and make rational decisions. The make-up phase, the abuser will eventually make promises, try and make the thing go away, but they don't ever keep those promises. Okay, the short-lived things. Immediately try and establish verbal and eye contact with the patient, the violent patients anyway. Never ever turn your back. Don't ever lose eye contact with these people. Check with the friends and family about the patient's history of violence, signs of potential violence, history of violence, yelling, verbal attacks, loud and obscene language, bizarre speech. Okay. Pacing and inability to sit still, and protection of personal space. There's always a telltale sign that the abuse of drugs and alcohol. Never force a potentially violent patient into a corner, and do not allow yourself to be cut off from your escape route or your route of retreat. Okay. Try and only be the one person that speaks to the patient. Don't allow too many people to bombard them with questions. Just keep it calm, keep it simple. Speak in a low, compassionate tone, and try and convince the patient just to be calm. Breathing helps. Anticipate the need to summon law enforcement personnel if all else fails. Always, when dealing with a mentally challenged patient or somebody that's got something psychologically wrong with them, it's always best to make sure that those patients are or restrained or very close to restrained before touching or being too close to them. Okay, factors that influence the risk of violence in the workplace. Working alone in small numbers, especially, we open ourselves up to things like hijacking and robberies and things like that, and just violence against us. Working late or early morning, working in high crime areas, and working in informal community areas or areas where they are not as well off as the other people in the other areas. All right, always be alert when you respond to a call that there's an increased chance of violence, including situations like crime scenes. Okay, when crime scene, don't disturb the crime scene. Try and not move anything. As little foot traffic as possible. Don't walk all over the whole place. Always use the same path in and out. Okay, incidents involving gangs. Certain areas in this country are renowned for gang violence. If you go there, please don't go alone. Rather, just get the SAPS to escort you in and out, whatever you need to do. Large gatherings of hostile people, potential hostile people. Crowds can be turned, they're swayed at the drop of a hat. So a very peaceful gathering can turn into a domestic or into a large-scale violent situations. Always remember, trying to minimize the risk of injury to yourself. Take steps to protect yourself and the other rescuers safe on the scenes. Keep an eye out before you get out of your vehicle. Make sure you get a 360-degree view. Look, listen, think, and act before you carry on. Always assess for danger. Routine assessment for dangers. Prevention is obviously better than cure. So where you'd see that things are exceptionally violent, rather stay away. Call for backup. Make sure you have an escape route in mind. Okay, the armed patient. It's not your role to handle armed patients unless you are a law enforcement officer. Be alert, summon assistance, stay in your vehicle and wait for the law enforcement to come. If you are confronted by an armed person, immediately report it and withdraw as soon as possible. If an emotionally disturbed patient agrees to be treated, few legal issues should arise. If the patient who appears to be disturbed refuses treatment, you may have to provide care against the patient's will. You must be has to have a responsible belief that the person would harm themselves and others. Okay. If you are required to restrain a patient, consider these factors: the patient's size and apparent strength. Remember, psychiatric patients have a lot more strength than they seem. The slimmest person becomes the strongest man, like Superman. The patient's gender as well. Types of abnormal behavior, the patient's mental state, and the methods of restraint. It's always safest to restrain a patient before treating them, especially these mental cases. All right. You may use reasonable force to defend yourself in an attack. Seek assistance from law enforcement officials, from your medical director. Okay, document the conditions present. Wherever possible, a caregiver of the same sex should take primary responsibility of this patient. Okay, suicides. Many patients who fail in their first attempt to commit suicide will try again. Okay. Underlying psychiatric diseases, which is sometimes untreatable or usually untreatable, is treatable. Review the risk factors that make it more likely that someone will consider to attempt suicide. Management: protect yourself and the patient from further harm. Obtain a complete history, sample history. Determine whether a patient has a weapon or drugs on him or her. Okay. Always support ABCs. Remember, airway, breathing, circulation. If that fails, start CPR immediately. Dress any open wounds and treat any spinal injuries. Do not judge the patient. Okay, treat the patient for his injuries and conditions you discover and provide emotional support. Post-traumatic stress disorder is a mental health or behavioral condition triggered by experiencing or witnessing a terrifying event. Symptoms include traumatic events, intrusive memories, avoidance of places and activities and people that remind them of the traumatic event. Sometimes loud bangs or screeching brakes or things like that will trigger these emotional responses that the patient can't handle, sending them deep into the PTSD. Okay, it's an emotional, it could be an emotional reactions and definitely negative feelings. What you can do is try and protect your patient from doing harm to them. Speak to the patient in a positive and supported way. Arrange for the patient to be transported to an appropriate medical facility. Okay, sexual assault, the psychological aspects of treatment are important. You may have to delay all but most essential treatment in order for the responder to have the same sex arise. Okay, your first priority is the medical well-being of your patient. Treat any injuries which the patient may have. Okay, sexual assault is a crime, and do not allow the patient to remove any clothing except to give in for medical care. Try and convince the patient not to bathe or use the toilet. Keep the scene and any evidence as undisturbed and intact as possible. Avoid aggressively questioning the patient. Use lots of empathy, lots and lots of empathy. You need to understand they've been through a very traumatic encounter. Death and dying. You will encounter death and dying from natural, accidental, or intentional causes. Do whatever you can to meet the patient's medical needs. Most people are afraid of dying. Work through their personal feelings about death. Okay, consider psychological needs of your patient and his or her family. Do not be afraid to touch or make positive statements, but do not give false hope. Provide comfort in any way you can. Okay, coping with work-related stress is quite an important thing for EMRs. Okay, emergency medical responders. If you let stress build up without being released in healthy ways, it can begin to have negative effects on you and your performance. Depression, sleeplessness, weight changes, rapid weight loss, okay, increase in alcohol and drug abuse, inability to get along with family and co-workers, they become exceptionally irritable, they lose their lack of interest in food, sex, things like that. Okay, always be very careful and aware of things when you're dealing with emotionally sensitive people, and always take care of yourself.